Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Metro Manila mayors push for a 2-week stricter quarantine and more vaccines to stop the spread of COVID-19. Also, the Health Department reports 97 Delta COVID-19 cases. And amid talks of lockdowns, what else can be done to deal with another wave of COVID-19 infections? Marikina Mayor Marcy Teodoro and infectious diseases expert Rontgene Solante join us live. Metro Manila mayors want tougher restrictions for the region as COVID-19 cases continue to rise. Adding to the concerns of local chief executives is the presence of the more transmissible Delta variant. They also ask for additional vaccines and ayuda should the national government heed their call for an enhanced community quarantine or ECQ. Let's go straight to the source of this story. We have Marikina Mayor Marcy Teodoro. Mayor Teodoro, welcome to the source. Thank you so much for your time.
Pinky, good morning and to everybody. As we all know, Metro Manila Council, composing of the different mayors, all the mayors in the NCR, have expressed their readiness for a tougher, stricter regulations with regards to the threat of the Delta variant. And we have also expressed some concerns that we see need to be addressed in case that there will be a change in the quarantine status, such as the social amelioration for the people that will be affected, especially those in the marginalized sector, and more supply of vaccines in order to ramp up the inoculation that we are undertaking now in order to protect our constituency and the people against Delta variant.
Understandably, Mayor, we have been reporting that yung ayuda at yung 4 million vaccines. But first, let's go to this. We are on heightened GCQ. Any information if we are going on a stricter quarantine status?
We're hoping for a stricter mobility regulations because we really need to safeguard our borders with the entry of the Delta variant. For example, in my case, my city is located near the boundary of the province of Rizal. So, and the very nature of this boundary is it is porous and people are highly mobile. So we need a stricter border control and we need expanded testing for the purpose of to provide surveillance testing kung nakapasok na o hindi pa yung variant sa amin. And we're expanding also our testing inside the city to monitor the clustering of cases. And we are undertaking granular lockdowns as it is necessitated by the clustering of cases.
Okay, so let's just make it very clear right now. We're still on heightened GCQ and we are expecting presidential spokesperson Harry Roque to make an announcement sometime today, because there was a meeting with the IATF yesterday. While we don't know that yet, as you mentioned, we do know that the Metro Manila mayors want a 2-week stricter quarantine. Should we call it a lockdown, sir? Ano ho ba? Lockdown, ECQ? Ano ho ba yung sinasabing proposal ng Metro Manila mayors together with the additional ayuda and the 4 million vaccines?
We're hoping a change in the quarantine status from GCQ to a higher quarantine status that will be able to address the concerns of the mayor, especially with the threat. Actually, it's no longer a threat. It's here already. In order to contain the spread of the Delta variant, in order for us to avoid the projection given by the health experts, especially by the DOH, with the increase and surge that we are expecting in the number of cases. For example, in Marikina, Pinky, i-contextualize ko na lang sa akin. In the last week, our active cases in Marikina, we're registering 2 to 3 cases only a day. But this week, actually yesterday, we registered 25 active cases. This is a significant increase in the number of cases. I think
Oh.
all of the metro Manila cities are similarly situated as of Marikina.
Pero ang gusto po ang sinasabi po ng mga mayors, ano po, ECQ. Kasi we need to understand ECQ, ho ba yun? Lockdown, ho ba yun? Exactly what?
Yes, correct, Pinky. To be direct about it, the Metro Manila mayors had expressed the readiness of the different cities for an ECQ.
ECQ, Mayor, so we understand it better, is a lockdown. Ang ECQ ho, di ba, lockdown at ang papayagan lang po ay essentials.
Essentials, but that will really depend on the discussions being done now between the health experts and also our economic managers in order to clearly define what will be restricted and what will not be restricted, what will be allowed
Opo.
and not allowed. So
Ano yung nakapaloob sa
tinitingnan
ECQ na
natin
yun?
din yun eh. There will be I think a more clearly defined regulations and also with regards to this Delta variant. Remember that this is a very this is a novel to us. So we're waiting for a clearer definition of things on what to follow. Secondly, it is important also to determine the ability to comply, the ability for compliance of our people, their capacity to comply, and vis-a-vis the capacity of the local government units to implement regulations at this point in time.
Let's talk about
we're hoping that all of this things can be controlled. Yes.
Mayor, how I understand it is you're ready for ECQ. Okay, that's sure. But gusto niyo pong may ayuda at may 4 million vaccines. So yung ayuda ho ba, Mayor, how much are you looking at and to whom?
Yes, based on those two contingencies, based on those two conditions, the ayuda and the availability of vaccines. Vaccines very important. We based on our data, the data that available to the LGUs is that the more we vaccinate, the lower the cases of COVID in a particular area. If the person is vaccinated, if he contracted COVID, asymptomatic lang siya or less severe. So those are our experiences. So vaccines, we think are very important. Ayuda, in order to cushion the effect, especially for those in the marginalized sector. How much? It will really depend on our economic managers on what they will determine the right amount to be given to the people.
And you are ready for 2 weeks, no, Mayor? At doon po sa 2 weeks, my understanding is, please correct me if I'm wrong, kung matuloy po itong ECQ that you were saying, magpapatuloy po ang vaccination. Tama po?
Yes, vaccination should continue. It's imperative within that period of change in the quarantine status, if ever it will be announced. If ever it will be announced. Similarly, we deem it necessary on the ground, based on our consultation and based on our assessment, that ayuda is also needed especially for those individuals who are daily wage earners, dahil wala silang magiging trabaho at wala silang kikitain. Kaya kailangan din na means for them to survive.
We need to take a very short break, Mayor. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Marikina City Mayor Marcy Teodoro. Mayor, para po sa inyo, dapat ho bang magpatupad na tayo ng ECQ sa lalong madaling panahon? And if so, when?
Pinky, our position really is the exercise of abundance of caution. So if we need to, in order to avert the spread of further spread of the virus, um, nakikita namin kailangan talagang magkaroon ng mas mataas na classification ng quarantine. ECQ if necessary. Kailan? The soonest time possible. If possible, now, ngayon. Dahil ayaw natin dumating yung pagkakataon that problema ulit yung hospital utilization natin. Kasi pag nangyari yon, I think it's already too late. If we're already experiencing a problem with the healthcare utilization rate, that's already there's already a problem. So we think that it is necessary at this point in time to exercise caution.
In fact,
Meaning,
Mayor,
what do we mean? We ramp up our vaccination. We expand our testing. We improve on our prevent, detect, isolate, treat, and reintegrate a PDITR approach. Those things we need to do.
in fact, Mayor, it was Octa that was already saying, go early and go hard. Kumbaga, parang yung sinabi niya, umpisahan na natin sa lalong madaling panahon para mapigilan natin ang sitwasyon na baka hindi natin kayanin. Parang ganun po yun eh. I want to talk about the cases in Marikina though. You were saying that you had normally averaged 3 cases, tama ho ba? A day, tapos ngayon umabot na po sa 25?
25 cases a day. So there's a spike or a surge in the number of cases. And we're sending samples to the Philippine Genome Center in order to determine if this is Delta variant or otherwise. We need to be extra cautious at this point in time. And we're undertaking an expanded testing and contact tracing efforts really. Nakikita namin ang increase is brought about by clustering in the family and also in workplaces. So in workplaces, for example, we think that we need to employ better health protocols, both engineering and administrative controls in work places.
Such as, I guess you're talking about ventilation, no, Mayor, in workplaces?
Yes, yeah, those kind of engineering controls, yeah. Ventilation, proper distancing among workers, having a unidirectional process in the workplace. Those engineering controls.
You know, those controls, though, Mayor, whatever happens, or at least in the next, I don't know, maybe 6 months, those have to be constant. They have to be there, whether or not, I guess, the Delta variant, well, the Delta variant is here, at least while COVID-19 is still here. But I wanted to ask you, what kind of other strategy? Are you thinking of any other alternative or any other option that you can employ or implement in Marikina as its mayor to prevent the further spread of anything new?
Anything new? I think sustainability is the key factor in order for us to prevent really or to contain the spread of this COVID-19, especially this Delta variant. We're thinking of border controls in the city to require some vaccination passports for the city. This is not being implemented at this point in time, but in order to encourage people to be vaccinated, to be inoculated, we're thinking of implementing passport system locally, requiring people before entry to an area that they should be inoculated or vaccinated. But of course, the problem here is the availability of the vaccines. So
Yeah.
that's the reason why also all Metro Manila mayors have expressed their concerns with regards to the regular ready supply of the vaccines.
That's what that needs to be found out, no, Mayor, from the National Task Force kung mabibigyan po nung additional supply and steady. I guess the operative word is steady supply of vaccines, especially in Metro Manila. So, Mayor, we have to wait and find out what the classification would be, if there will be any changes, any announcement today. And I'm sure the Metro Manila mayors again will meet. So in the meantime, sir, I'd like to thank you for your time and please take care, Mayor Marcy Teodoro.
Salamat, Pinky. Thank you very much.
And we will be taking a short break. We will have Dr. Rontgene Solante after the break. Stay with us. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, infectious diseases expert, Dr. Rontgene Solante. Dr. Solante, again, thank you for your time. I'm going to already ask you, what is your personal opinion? Are we okay right now with this heightened GCQ, or must we go on a stricter lockdown?
I think I'm still with this GCQ with heightened restrictions, no? Primarily, if we will be on lockdown, I'm really thinking about the economy at this point in time. And the hospitals are not yet really full. And very important here at this point in time, we should already be prepared on how to really cope up with this type of surge. And the case is not that yet that is so overwhelming that we can have lockdown is for me. It's an option. No? So here the LGU, the contact tracing, the active case finding will be very important because the indicator of surge of cases will always be in the community. If there will always be poor contact tracing and active case finding, that's where the problem is. Even if you do the lockdown 2 weeks or 3 weeks, that will not solve the problem totally.
Mm-hmm. Are you comfortable with our contact tracing capability?
I really want to believe that we should be capable on that matter, because if we will be going back and forth that our contact tracing is poor or something like that, the government should really be steadfast in focusing on the contact tracing and the active case finding. Otherwise, we'll be going to this cycle of lockdown, open, lockdown, open for how many months?
Which to some say really is not the solution. But let's point this out. Even the apps, the contact tracing apps, they're not interconnected right now from city to city. We don't even have one universal contact tracing app that we use, that everybody uses.
But, everybody use it. But I think we really have to engage the LGU. They have the current gaps now is that most of the LGUs are focusing on the vaccination, and then that's okay with me, you know. But I think they should not also forget the other part of controlling this pandemic, which is really active case finding and masusi at talagang yung tinatawag natin na seryosong contact tracing.
Yeah. Let's look at the numbers, because you said the numbers are still okay. In NCR, we recorded 1,332 cases Thursday. I think that's the highest in the past 3 months. And that's up from Wednesday of 1,051. But this is NCR. In other words, we increased 300 cases in one day. That's in NCR. I was speaking to Mayor Marcy Teodoro a while ago. Sabi niya normally 3 active cases sila. Ngayon 25. Hindi ho ba yun cause for alarm already?
I'm looking at the hospitalized COVID positive, because for me, when you have full capacity already of the allocated beds, then that's something that's already in the community. There will be enormous cases. As of now, if I'm looking at our hospital and in some other private hospitals, there is already pending like 3/4 full, 1/2 full. But I think for me, we can still manage this in the next 3 to 4 days.
I'm not a big fan, to be quite frank, on the half full, because that really depends on the number of beds we have. The point I'm trying to make, Dr. Solante, is we can say we're only at 50% full, but our bed capacity really is just, for example, 1,000, compared to maybe another country where your bed capacity is 10,000 and you're 50% full. Ibig sabihin, mas mataas pa yung availability na beds kumpara doon sa availability ng beds na mababa po yung sa ibang mga bansa. So anyway, are you even looking at a possible benchmark number? Ganun ho ba yun amongst you, siguro experts, health experts, na pag umabot tayo ng 8,000, ganun ho ba yun, 9,000, delikado na? When is it a red flag for you?
If I'm going to base the previous surge last March to April, I think we have gone up as high as 12, 13, and 14, where the healthcare facility was overly overwhelmed at that point in time. No? And ganito lang yan, no? When you have a GCQ with heightened restrictions, it's more of bordering also already on the ECQ, no? Ang nakita ko lang talaga dito is the compliance, especially sa mga establishment na, di ba, meron naman tayong limitations, but you see a lot of people are still going out in the transportation system. Nakikita natin talagang wala na yung physical distance, talagang siksika na, no? And that is not the heightened restrictions that we want to imagine, no? So kung siguro susundin lang and we have to be compliant with the heightened restrictions in the GCQ, yun ang magiging kalabasan na talagang we have to follow that guideline to the hill.
The Metro Manila mayors were saying they're ready for a stricter quarantine classification as long as meron pong ayuda at merong dagdag na 4 million vaccines. Do you think, Dr. Solante, because vaccination is of course very important, that kailangan talagang dagdagan na yung supply sa NCR dahil nga, well, much of the economy really thrives in NCR and Calabarzon?
Yeah, because I totally agree with you, no? Na if we are going to prioritize the vaccination, the primary region should be the NCR plus bubble, no? Because this is center of the economy, and the population density is a determinant of why we have higher risk of getting cases.
NCR siguro +8 na nga, no, Dr. Solante, because it also includes Cebu and Davao in this NCR +8. Okay, so there's supposed to be an announcement today by Secretary Harry Roque, and we will see if there will be any changes. In the meantime, Dr. Rontgene Solante, sir, as usual, maraming salamat po sa inyong oras.
Thank you, Pinky, and stay safe.
You too, sir. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.